You're welcome to my channel. Today I'll be talking about fatigue and I'll be going through possible causes of fatigue. By way of definition, fatigue is a form of feeling of tiredness or extreme tiredness with lack of energy, feeling more to sleep without any motivation to work. When it comes to fatigue, there are red flags. That will include depression, suicidal ideation or suicidal attempt, chest pain, palpitations, fainting, or hypoglycemia. Other red flags will be back pain, headache, bleeding, shortness of breath, anemia, abdominal pain, or pelvic pain. Now that we're out of the red zone, we will go through the list of other possible causes of fatigue. Poor diet. We all understand what a balanced diet is. Too much coffee, low sugar in your blood. When you are hungry, you can be tired. Okay? Vitamin B12 deficiency, particularly if you are a vegetarian, no meat. Decreased sodium, that is hyponatremia, can give you fatigue. Diarrhea, whatever you've taken, you've been to the washroom or toilet, depending on where you are, and vomiting. What you have taken in, you've vomited out, particularly in pregnancy or some other conditions that will lead to vomiting. Certain medications might be responsible, like sedatives, for example, lorazepam or diazepam, anti-hypertensive agents, maybe you have high blood pressure and you have medication to handle that, or you have convulsion or seizures and you're on medication to handle that. Tricyclic antidepressant like amitriptyline or nortriptyline, selective serotonin reuptake inhibitors like citalopram or Zoloft. You are selective norepinephrine reuptake inhibitors, so all these medications can lead to fatigue. Stimulant medications, antipsychotics, muscle relaxant, as it's relaxing the muscles, is going to make you feel weak. Steroids, chemotherapy or radiotherapy. There are certain social stressors that could lead to fatigue. Jet lag, flying from one zone to the other. You can check my channel here for a full presentation on jet lag. Mood, you are sad. Okay, something happening around you that is uncomfortable, that could make you feel weak and tired. Grief, physical abuse, intimate partner violence. I have a separate presentation on spousal abuse right there. You can check my channel for that. Too much stress. If you pass through a lot of stress, you're bound to feel weak after. Work burnout. Executive, doctors, nurses, police officers, pilots, many hours, keeping yourself awake, going through many documents, going many places, then you are exhausted. Child nursing, particularly to the new mothers to the first child, because they've not had experience, right? Now the child is waking up in the middle of the night, then they are tired in the day. Exercise, sedentary lifestyle will make you feel more fatigued than being active. Or you are active but excessively active, like overexertion, can make you feel tired after. Physical inability to exercise, chronic fatigue syndrome, pain, or obesity. Psychiatric conditions that could lead to fatigue, dementia, depression, and suicide. I call out these because once you have depression or suicide, that is red zone. And Red zone means you have to stop and you must seek help. Antipsychotics or antidepressants all will lead to fatigue. Diseases like insomnia, chronic fatigue syndrome, obesity, hypothyroidism, hyperthyroidism, or flu, seasonal flu, can lead to fatigue. Still on diseases, COVID-19, fibromyalgia, Addison's disease, hypertension, heart failure, chronic obstructive pulmonary disease, renal failure, or liver failure, all could lead to fatigue. Still on diseases that could lead to fatigue is HIV, malaria in endemic regions, hypotension, autoimmune conditions, diabetes mellitus, inflammatory bowel disease. Lastly, on diseases that could be involved will be multiple sclerosis, amyotrophic lateral sclerosis, or infectious mononucleosis. With that, I've come to the end of possible causes of fatigue. Remember the red flag, okay? We must act immediately. Not saying that we will not act on other possible causes, but some would demand urgent attention than the rest. Thanks for listening. Remember to subscribe to my channel. Remember to share this very presentation. I appreciate it.